Plowing through a global pandemic, it's not unexpected for people to be overcome with fear and anxiety. Those are the two of the reasons for the run on toilet paper in the spring of 2020. Remember that? Remember when that happened? Well, now there's another shortage concern out there, and it has to do with actual COVID patients. We've seen anecdotal reports from people saying there is a lack of oxygen and oxygen tanks. But our question is it true? And if so, it's got to be a big deal. Joe Paris went to the source, that'd be Norco Medical, to get insight on the oxygen and the tanks that carry it in our area.
The dramatic surge in COVID cases in Idaho continues to put heavy pressure on the state's medical system. A new concern from the community: is there a shortage of oxygen and oxygen tanks, which are needed to treat very sick COVID patients? One of the primary suppliers of oxygen and oxygen tanks in our area is Norco Medical. We checked in with them to see what they're seeing.
The word oxygen gets generalized as many things, and of late there's been some concern that is there an oxygen shortage? The fact is, no, there's not an oxygen shortage. In fact, there's an abundance of the molecule oxygen, but like every supply chain globally, deliveries, services, and fulfillment of orders can be delayed. Some things can take a little bit longer.
Elias Margonis is the president of Norco. He says, similar to the rest of the medical system, oxygen supply services are currently impacted by the recent COVID surge in our state.
I kind of draw the comparison to what's probably happening in ERs. What do you do when 20 patients all walk in at once? If you only have 10 beds, you have to figure out what to do with those 10 patients in the interim. At the same time, if Norco is given 20 orders to set up patients with oxygen in the home, and we have equipment to handle all 20, we're still probably figuring out how to schedule all of them at once.
So how does this all translate to an individual care level? A primary difference comes down to oxygen tank distribution amid unprecedented demand. And it's not just about what's going on now, but rather what could happen soon.
What's happening right now is we may have to discharge patients with a smaller quantity of cylinders that we normally would like to. If someone would normally leave with 10 or 12 cylinders to go home, we may be sending them home with 4, 5, or 6 cylinders. And again, that's to prepare for the surge ahead of us and the patients that will need those cylinders in the future so that we don't run out. We aren't running out, but it's all about getting those cylinders back so we can fill them and get them back out to the other patients.
From what I'm hearing from you, that people are going to get the oxygen they need, the tanks they need. However, the service may just be different in terms of how it works than in the past. Is that fair?
I think that's generally correct. You know, I think there's a limit to everything. My leadership team and I were actually discussing this morning, and we certainly all agreed that the word that we'd like to use right now is that things are getting tight. And the concern is just how much tighter will it get?
With that in mind, Norco is asking the community to share any unused or unneeded oxygen tanks with them.
If you're aware of someone that has extra cylinders or assets they're not using, I would advise them to call their local branch and see what they can do to help give stuff back. And again, if there's a need for more or something else, I encourage people to call as well.
And Norco also wants to extend a thank you to their staff, which are also frontline healthcare workers. If you think about it, the Norco staff, they're driving their vans around our area and across the state of Idaho, getting in the homes of people that are sick, bringing them the oxygen they need, the tanks they need. So Margonis wanted to make sure he knew that the Norco staff is appreciated. He knew that they're appreciated. And Brian, I know that there's been a lot of questions about, well, okay, Norco says this is the situations. What is the area hospitals saying? And I just want to say I reached out to several hospital systems today and some hospice centers as well. Not everyone's immediately able to respond. We know they're dealing with a lot right now, but St. Alphonsus did get back to us. I want to read a quote from St. Alphonsus. They say, quote, home and health hospice teams are not having any problems getting oxygen for patients. Neither are our hospitals. So that's some good news. There are some questions though about, okay, what about the oxygen supply inside the hospitals? One thing that I do want to point out that I spoke with the team at Norco is things are changing in terms of the treatment for COVID. You have these high oxygen flow treatments that don't require a ventilator that are now being utilized in a lot of hospitals, and that takes a lot of oxygen. The problem is that smaller hospitals, not the major hospitals that you may see in Boise, but at smaller regional hospitals, they used to get a shipment of oxygen maybe once a month or once every few months because they only needed so much. But with the changing of how we treat treat COVID with the high flow oxygen treatment, they need more oxygen than they've asked for previously. So if they needed to fill up every few months, now they're asking for every few weeks. That's just not how the system was set up. That's just not how the infrastructure of this whole system was created. So it does cause some delays and some problems.
Does that mean that some of these rural hospitals have to send patients who need oxygen to bigger hospitals then?
In some cases, maybe. In some cases, no. It's all, each individual circumstance is different, but we do know that there's pressure on the system. And when we talk about crisis standards of care, it's not just in the hospitals, it's the whole medical system.
And even the smaller ones, or mostly the smaller ones, having felt this impact as well. All right, thanks, Joe.